So I am Brittany Hernandez. I am MDA Senior Director of Policy and Advocacy. I'm joined today on our call by Paul Melmeyer, our Director of Regulatory Affairs, and Mark Fisher, our Advocacy Engagement Manager. And want to say thank you to all of you for joining us for our very first Advocacy Institute of 2021. I'm really excited to clue you all into our policy priorities and advocacy work that we will be undertaking this year in 2021, and would love for your feedback throughout and during the call. This call is being recorded, so if you want to share with someone else after it's over, we will be posting a link to the on the MDA Advocacy page, and we'll make sure that that's easily accessible, so you can share it with anybody who might want to tune in but wasn't able to join today. We can go ahead and get started. Mark, you can hit the next slide. There we go. So we have a pretty simple agenda here, and I love this picture from one of our, this is one of our interns from last summer when he was with us, not last summer, I guess the summer before, on the Hill for meetings. So we have a lot to get into today. The first is we'll give an overview of our policy and advocacy priorities for the year. We'll talk a little bit about why we advocate, the role of our grassroots advocacy volunteers, and how you can take action now. We have some exciting updates about things that are already happening. And there will be things for you to do at the end of the call, so stay tuned. So as I said at the top of the call, these are all the people that are involved or lead the advocacy department at MDA. We have many colleagues across the organization who are not official members of the advocacy department, but do a lot of advocacy work, and we are really, really lucky to count so many of our colleagues throughout the larger organization as partners in our work. But the three of us are the ones who really lead all of the policy work, and you can see our beautiful headshots here. And feel free to reach out to us anytime, and now you know what we look like in case you want to chat. All right, so first I'll go through our 2021 policy priorities. These are pretty similar to what we set out in 2020 when we had, a lot of great ideas about what 2020 would look like way back in January of 2020. And so while we did execute and have a lot of successes and a lot of these things, we are still using these policy pillars to really guide our work throughout this coming year as well. We've amended them a bit to reflect, the current the current impacts of the pandemic and other complicating factors. But, they really are, a continued guiding light for us here at MDA Advocacy. So our first pillar is titled Access to Care and Therapies from Day One. This pillar really focuses on everything related to early detection and intervention, including things like genetic testing, newborn screening, genetic counseling, to make sure that folks can get that diagnosis. We focus in this area on work around affordable, accessible, adequate health insurance to ensure that once an individual has a diagnosis or is on their way to a diagnosis, that they can get the treatment that they need in a way that is affordable to them and appropriate for the condition that they have been diagnosed with. And we also, in that area, do a lot of work around private health insurance, but as well as, shoring up the Medicaid program, ensuring that states have the funding that they need to sponsor very robust programs that can meet the needs of our community and others. And obviously now a lot of work on telehealth. Telehealth is an access issue to ensure that not just during the pandemic, but after it's over, that folks can continue to receive the care that they need in the manner that best fits their needs. So we are going to be very careful to ensure that just because telehealth is an option now, we don't want patients in our community to necessarily feel like they have to do telehealth visits if they want to go see their doctors. And so that's policy that we'll be working on throughout the year, as well as a lot of other nuances around the telehealth policies once the current public health emergency for the pandemic ends, and all those telehealth changes that have been made and are currently in practice. And so, but I'm really proud to work with, across this organization and all the patients that we represent, as well as a number of other patient groups, and partnering on the needs of patients when it comes to telehealth. Our second pillar is related to accelerating therapeutic development. Everything around here is our work with FDA, work with Congress to ensure that, that legislation put forth always encourages development and does not hinder it. We're obviously closely in touch with FDA around and CDC around access to the COVID-19 vaccines. We've done a lot of work on this, and I'll throw it to Paul a little bit later to detail it, but we've done a lot of work on this to ensure that the neuromuscular community can have access to the vaccine as soon as possible. We have also worked to ensure that the neuromuscular patient community voice is considered in new drug development and review through our work on the patient-focused drug development program. And we continue to advocate for innovative approaches to trials and development. And a lot of this will relate to the work that we have done most lately regarding clinical trial changes to ensure that throughout the pandemic, modifications can be made to trial structure so that folks can continue to participate in trials, even if maybe they can't do so in a physical office location or other healthcare facility because of social distancing requirements. Our third pillar focuses on empowerment and independence. This is focused chiefly on all of the work that we do to guarantee civil rights for people living with disabilities. So we have a big focus on accessible air travel. We always hear that this is something that unites the neuromuscular community. Air travel is important, not just because people need to travel for work or fun or to see their family, but because folks in our community, if they have a very rare condition or even not very rare condition, maybe they want to go see a physician, they need to see a clinician or a researcher on the other side of the country. They want to participate in a trial that's not close by. And to be able to travel is integral to their ability to access those things. We are partnering with Champions on the Hill around ending workplace discrimination against folks with disabilities to ensure that workplaces are accessible both for employees and for customers and clients. And then we're also going to be rolling out some exciting new stuff this year on access to higher ed for the neuromuscular disease community. We know that this is something that is particularly important for the children that MDA represents now, but as they are growing up into adults and leaving home, we want to ensure that we are providing tools and promoting policies that will help them go to the colleges they want to go to, wherever those may be. Hit the next slide, Mark. All right. So I talked about all this. I'm sorry. So I'll get into this a little bit more, and then I'll throw the next slide to Paul. So under that first pillar, early detection and intervention, we do a lot of, I'll pull out newborn screening on this. I actually just got off another call on newborn screening, and newborn screening is so important to our community because there are two conditions currently on the nationally recommended list for that all newborns should be screened for that are neuromuscular conditions, so SMA and Pompe disease. And MDA worked across the patient community with the other organizations that represent folks in the Pompe and SMA communities to advocate on behalf of the addition of those conditions to the national list. And we continue to work now to ensure that states are actually implementing those recommendations by the federal government. We've seen in the last year in the last 2 years, a great uptick in the number of states that are screening babies for SMA and Pompe. And now we are really proud and pleased and looking forward to all the work that's being done by MDA and other organizations and researchers to put forth a nomination to add Duchenne muscular dystrophy to that national list of recommended conditions. And that's a long process, and it's probably worth a whole advocacy institute to talk about, what it takes to add something to the list and get it implemented. And I would love to do that at some point later in this year. But for now, please just know that we are working with partners and colleagues across the community towards a nomination for Duchenne. Obviously, a lot of the work that we do around access to quality, affordable healthcare is related to private health insurance. We saw a lot of work happen over the last couple of years regarding amendments to to current law that could threaten access to private health insurance, um, or the adequacy of private health insurance, and we're pleased to stave a lot of that off, and we'll continue fighting to ensure that private insurance is appropriate for all folks in our community, that people with pre-existing conditions continue to not be discriminated against, and that they can receive the care that they need. And as I said before, telehealth policies will continue to be a high priority for us. Next slide, and I will let Paul go into this.
All right, well, good afternoon, everybody. I am Paul Mellmeyer, Director of Regulatory Affairs at MDA. I'll start with just actually one quick warning. I do believe I was one of those individuals affected by the internet outage on the East Coast today. So if I happen to hop off, I'll give it back to Brittany, and I'll then jump back on the phone and we can continue from there. Let's hope that doesn't happen. All right, so as Brittany already introduced, we have a lot planned for our efforts to accelerate therapeutic development in neuromuscular diseases in 2021. Now, of course, our overarching goal has not changed. That goal is to get more and better therapies to the neuromuscular disease patient community as soon as we can. Now, of course, the individual efforts within that overarching goal may be new to 2021. Very excited by them. So let me start just with our effort to expand patient involvement in therapeutic development and review. We know that patients can't be too involved when it comes to developing a new therapy or when it comes to FDA reviewing that new therapy. So we're always looking for ways to get the neuromuscular disease patient community more involved. That includes working with the Food and Drug Administration itself, specifically the offices within the Food and Drug Administration that administer programs that get patients involved with therapeutic development and review, including the patient affairs staff. We've worked with them on co-hosting webinars and other educational opportunities, and we'll continue to do that in 2021, including getting individuals within the neuromuscular disease patient community signed up for the patient representative program, and many other collaborations that we are looking to develop and that we already have developed and that we will continue with the Food and Drug Administration to ensure patients are involved. But it's not just the FDA, it's also biopharmaceutical companies, and working with those companies that truly do hope to move forward with a very patient-centric therapeutic development effort. And that includes working with companies to ensure that they are fully aware of what the neuromuscular disease patient population wants in a clinical trial, such as open label extensions or expanded access, such as the number of trial sites and their accessibility, such as many other things that just make clinical trials a lot easier for individuals in the neuromuscular disease patient community to participate in. On advocating for innovative ways to accelerate development and FDA review, we have a lot on the plate for 2021 because there's a lot of work to be done. For one, FDA's expedited review programs intend to speed FDA's review of new therapies, especially those therapies that are truly innovative, those really groundbreaking new developments, those new drugs that then can come to market. Now, there still can be improvements that can be made. For example, we can do a better job unlocking the accelerated approval pathway for those in the neuromuscular disease patient community by ensuring that there's enough research and validation of biomarkers and surrogate endpoints. We can also streamline the use of these programs and even take some of those really innovative new programs that are happening in the Food and Drug Administration in the Oncology Center of Excellence and seeing if they can work in neurology, seeing if they can work in neuromuscular diseases. It also includes ensuring FDA is really on the cutting edge of using the most up-to-date, not only review mechanisms, but also mechanisms to speed clinical trials, such as using master protocols and being flexible in their assessment of effectiveness and whether the data is there to actually demonstrate substantial evidence of effectiveness. All ways in which FDA can improve, all ways in which we will be advocating for FDA to improve in 2021. And additionally, we're also looking to create new programs, both not only at the FDA, but actually across the federal government that would be beneficial for individuals in the neuromuscular patient community as it pertains to accelerating access to new therapies. This includes several new programs that would be included in the bill called the Act for ALS, which is a piece of legislation that we support that was newly introduced in November. And some of the programs in that bill include a brand new HHS collaborative on neurodegenerative diseases, which gets everybody within the Department of Health and Human Affairs and the federal government together around the same table to talk about how we can accelerate access to new and better therapies. Also includes a new strategic plan from the FDA and a brand new grants program to fund neuromuscular and neurodegenerative disease research. So these new programs could make a really big impact if they are enacted by Congress, and we're going to be advocating to Congress to ensure that not only do they hear our voice, but hopefully that they'll enact the bill sooner rather than later. In addition to that, of course, COVID-19 still is playing a very major impact on clinical trials. Over the last 10 months or so, we've been carefully watching how FDA has been advising the biopharmaceutical industry on how to amend their clinical trials to ensure that they can continue, to ensure that the innovation that had been going before COVID-19 is certainly not stopped, perhaps not even slowed, to ensure that these new treatments that are in clinical trials right now can still reach the neuromuscular disease patient population as soon as possible. So what we've been doing, we've of course been working with the FDA to get that information out there, not only to the neuromuscular disease patient population, but also biopharmaceutical industry partners. And what we'll continue to do as the pandemic continues, and even after the pandemic hopefully abates by the end of the year, is all these clinical trials that were affected by the COVID-19 pandemic, they're going to be submitting data to FDA, and FDA is going to have to review that data. And we're going to be hopefully advocating to the FDA to be very flexible in how they review that data to ensure that these clinical trials don't go for naught, essentially, that they are still showing that safety and effectiveness was proven within that specific therapy. Finally, on this slide, with our new Congress and with our new administration, we know affordability is going to be one of the main conversations happening over the next 2 years in Washington, D.C. And we're certainly going to be keeping a very close eye on those conversations to ensure that the neuromuscular disease patient population is well represented. To move to the next slide, probably what is on the hearts and minds of most individuals these days is access to the COVID-19 vaccine. This is something that we know everybody, it unites everybody across the United States for the most part, wanting to access the COVID-19 vaccine, and that's of course no different for the neuromuscular disease patient population. So what we've been doing over the last several months is we've been trying to ensure that not only the Centers for Disease Control and Prevention, but also all 63 jurisdictions that are in charge of actually distributing the vaccine are well aware and well educated on neuromuscular diseases, so that if an individual with a neuromuscular disease seeks access to the vaccine, they will have access when the appropriate phase is opened. So in December, we actually we wrote letters to all 63 jurisdictions, opened up conversations with each one, spoke to several on the phone, had many other opportunities to communicate with them, just to ensure that they heard from us. They heard from the neuromuscular disease community, so that they knew that we were seeking the vaccine when it was appropriate to obtain. Not only that, we want to ensure that if an individual with a neuromuscular disease wants the vaccine, that they can get it within phase 1 of that jurisdiction's plan. Now, that doesn't necessarily mean 1A. Now, 1A is when most healthcare personnel and individuals in long-term care facilities are getting the vaccine. What we mean is when any individual ages 16 to 64 with one of those common diseases that the CDC lists as a high-risk condition, such as obesity or diabetes or cancer or heart disease, that individuals with individuals with neuromuscular diseases can also access the vaccine at the same time. And just because it's a rare disease, just because it's not actually on the physical list that the CDC puts forward, does not mean that our community should be disadvantaged in accessing the vaccine. And that was our message to the jurisdictions, and that's going to continue to be our message to the jurisdictions as we carefully watch vaccine rollout. Now, and that's what we're doing. We're keeping an eye on every jurisdiction as it is rolling out the vaccine. Many jurisdictions have not opened up the vaccine to those in the high-risk condition category as of yet. They're either still vaccinating healthcare personnel and individuals in long-term care facilities. Perhaps they've moved on to individuals who are 75 years and older. But we also know many jurisdictions have opened up access, or at least eligibility, to the vaccine. Of course, there are supply shortages, there are appointment shortages, and so forth, but they've opened up eligibility at the very least to those with high-risk conditions. So what we're going to be doing, we want to be sure that the community knows about when the phase for each jurisdiction that is for individuals with high-risk conditions, when it is opened up, that the neuromuscular disease community should at that point, first, of course, always consult with your healthcare professional first, your doctor, your nurse practitioner, whomever, to ensure the vaccine is right for you, but then also to perhaps seek the vaccine from there. And if a jurisdiction is refusing access to the COVID-19 vaccine for the neuromuscular disease community, because perhaps, let's say, ALS or spinal muscular atrophy or mitochondrial disease isn't on CDC's list because it's a rare disease, if a refusal was happening, that's where we want to step in, and that's where we're going to be advocating for you to try to make sure that that jurisdiction is not going to refuse access any longer. So as you can hear, we have a lot going on with the COVID-19 vaccine on top of everything going on in accelerating therapeutic development. An exciting year ahead of us. I'll turn it back over to Brittany.
Thanks, Paul. On our third pillar, which I already mentioned, I think I kind of ran through all of this already, around some of our priorities regarding access to air travel, ending workplace discrimination, and encouraging employment of individuals living with disabilities, and ensuring access to higher education for the neuromuscular community. We're excited to be working with some new partners in this area. I'm excited to continue our work with Senator Bob Casey's office, who is the Senate champion of civil rights issues for individuals living with disabilities. And are excited about the new administration that's come in with a very aggressive agenda on disability issues, and President Biden is putting a disability civil rights lead in the White House. We know that we're going to see a big focus on this at the Department of Labor, Department of Health and Human Services, and other agencies across the administration, and are looking forward to engaging on regulatory issues around this, and not just legislative ones. So really looking forward to opportunities here. I see we have a couple of related questions in the Q&A here related to this issue area, so I'm just going to go ahead and answer them if that's okay, Mark. Okay, great. So the first is, what are your strategies and goals around ending workplace discrimination? Does this include eliminating income caps and asset limits and access and funding for home and community-based services? So I will say that with this current administration, as I kind of recently mentioned, I don't think anything's off the table, so long as we can work to find consensus with our other organizations, our champions in Congress, and with the emphasis that's being placed on this by the president, being placed on these issues by the president, I really do foresee a lot of exciting movement here in the coming couple next years, and so we will have a lot more to share on that soon. So please stay tuned. Our second question related to this issue is, or actually not directly related to it, but I'm just going to take the question anyway, Mark. What, if anything, is MDA doing to address the needs of the neuromuscular community at the state and local levels? How are you engaging local offices and advocates? Okay, so this is a great question. And I will say that the entirety of the MDA advocacy team is the three people on this call. And so while we would like to be like a lot of other organizations that have, state teams and people across the country, the reality of the situation is that we don't. And so we rely very heavily on our advocates and volunteers to help us in this area. We do have to, prioritize the issues on which we engage on the state level. For example, we are engaging very actively around, the rollout of the vaccine for individuals with neuromuscular conditions. And so that is all state and jurisdictional work that we're doing. We engage in the state level around implementation of new ward screening conditions. And as we identify other areas where we can really find consensus amongst the larger neuromuscular community, those are really the places or the issues that we can engage on the state and local level. However, we want to hear from you guys about stuff that's happening in your state or in other states that you think that we can or should get engaged on, or that you want help getting engaged on. Because just because, maybe I don't have a plan or a process specifically for a bill that was introduced in Mississippi or Michigan or California or anywhere else, it doesn't mean that we can't be of assistance to people who want to do their own advocacy on that and help guide you. So don't hesitate to reach out to us ever about, state and local policy work. We're really thrilled to be able to, utilize the resources that we have and the expertise that we have internally to help you in the work that you may want to do. And when we do hopefully get to a point where we can allocate more time and resources to state focused advocacy, that's definitely something that we will loudly share with our community, because we need your help. I see, let's see, there's a couple of other questions. Let me just see if any of them relate to this pillar. Okay, let's hit the next slide and then we'll get to the rest of the questions at the end.
Sounds good. Hey, everybody. My name is Mark Fisher. I'm our Advocacy Engagement Manager here at MDA. And just to add on a little bit to the last question that Brittany answered about our state work, we also do lots of coalition work. So we work with coalitions from a lot of other organizations who might have more impact in the states. They might have staff in the states. They might have connections in the states. So we work with healthcare coalitions that do some state work. Obviously, what Paul said about the COVID work was all state work. And I'll talk about this in a second. We do some newborn screening work as well. So although there's just 3 of us here, we work as creatively as we can to get as much state impact as we possibly can. So just wanted to add that real quick. So now that you know what we're working on, what can you do to help? And I see we actually had a question that came in that tees us up very perfectly about what volunteer and advocacy opportunities are there, and I will get to those in a little bit. But before we get into that, just wanted to step back and say, why do we do what we do? Why does MDA lead advocacy efforts? And I think sometimes folks get surprised nonprofits like us get involved in the legislative process. It can be a little sticky. It can be a little dicey at times. So why do we even venture into this? And the key is we have to. For us to really transform the lives of people affected by neuromuscular disease, which is our mission statement, we have to get involved, and we have to get involved 100%. So in order to achieve our goals, we have to make sure that folks can receive care from day one. We have to make sure they can get the health care they need when they need it. We need to make sure they can get access to the COVID-19 vaccine. We need to make sure that they are not discriminated against in the workplace. Everything that Brittany and Paul mentioned, we need to make sure we accomplish those if we truly want to transform the lives of people affected by neuromuscular disease. So that's why we do what we do. I know that's why you do what you do. So I just want to tee that off with that statement. So what can you do to help us? Again, we just got a question about what can you do to help us? And the answer is a lot. There's a lot of things you can do as a grassroots advocacy volunteer. And I have a few listed on the screen. And the good news is there's something for everybody, no matter what you're comfortable with. So obviously in the time of COVID-19, a lot of our activities are online. And the first step is to sign up for our list. Many of you already on our list because you're in this webinar, but maybe you got this from a friend or saw it on social media. So if you haven't signed up yet, I'll tell you how to do that, but that's your first step to help get us involved. And we'll send you timely updates about how you can help and things that are going on. In those timely updates, we will show you how you can email or tweet your member of Congress on issues that are important to you, like the ones we just spoke about earlier. And they really do work. Members of Congress really do want to hear from you. They want to hear your opinions. And as a collective, we really can make a difference when we contact Congress. And I'll show you some examples of that. But also, we affect change on the agency level. A lot of things that Paul talked about, grassroots volunteers get involved with. We've had grassroots volunteer contact agencies all last year, including Health and Human Services, Department of Transportation, just to name a few. And although they're not Congress, they issue guidances, they issue rules, they issue lots of things that, frankly, are very powerful and can affect the community. So please don't forget about government agencies. Their work can affect all of our lives, and our grassroots advocates contact them. Obviously, you can help us with educational webinars. You're on one right now. We aim to do these about every month or so, and on a variety of topics. Last year, we did one on voting rights. We did one on employment rights. So they really vary in what we offer for educational webinars, but some way you can get involved. But the number one thing you can do as a grassroots advocate is share your story. Myself, Paul, Brittany, we can go to the Hill all day long with our fact sheets and our numbers, but sometimes you just need that really powerful story to break through, and that's really your power, is your story. So you can share your story with us on our website. But also, if you email your member of Congress, or maybe you do phone your member of Congress, which I'll talk about shortly, please share your story. Share how this law could affect you and your family. It really makes a difference if you can insert that personal touch, and that's really your most powerful tool in your grassroots toolbox. We also do things offline. This might seem a little odd because the first one says virtual, but we still intend on visiting members of Congress's offices, but we've had to do that virtually now. And that really goes to the question we just got about what can we do because of the pandemic. This has actually opened us up to visit our members of Congress's office easier than it was before. You don't have to fly to DC. You don't have to go to the local office. We can visit them via Zoom or RingCentral or all the various platforms out there, and it really makes a difference. Last year we had a virtual fly-in where we had advocates just do that, where they remotely met their members of Congress, and we've had an amazing success story out of that, which I'll share in a second. You also can go old school and call your members of Congress on the phone, and that works just as well. You can write blogs and other pieces for us. The image on the right is a blog post that we had Ryan Colburn write about about why he wanted to participate in a meeting with the FDA. And we've had a few advocates write wonderful pieces for us that we promoted on MDA's main blog. So that is definitely something you can help us with. You also can organize in the community. So those are a lot of things you can do to help us. Again, anything that, no matter what you're comfortable with, there's an option for you to help us out. Now, in saying that, if we ask you to take your valuable time to help us, it's my job to make sure that it's going to make a difference. I'm not going to ask anyone to give up some minutes of their day or put things aside to help us if it's not going to help out pass a law or help pass a rule or program. So I wanted to share just some of our successes last year, and it's amazing to see these on the screen knowing what 2020 was, but we really together did a lot of amazing things. And it's because of your voice. So first, we've had amazing success in the newborn screening program. I'll get to another one in a minute, but one of the one I wanted to highlight is literally thousands of MDA advocates contacted the Secretary of Health and Human Services, and because of that, they restarted a key committee on this newborn screening program. I know that sounds really wonky and in the weeds, but that key committee was crucial for that program to continue functioning properly. So that was might something in the weeds, it's an agency, but it made a huge difference for that program, and it occurred because of grassroots advocacy. Many of you contacted your lawmakers on the various COVID-19 legislation, and a lot of good things came out. A lot of good pieces of law came out because of that advocacy, and I'll share one in a second. Late last year, a law was passed that finally allowed folks who are diagnosed with ALS to access their Social Security disability benefits immediately and not have to wait 5 months like they did before. So that was a big victory for us. It took years, but it's because of you and that you kept your voice up that finally passed. So that was a great victory for us last year. The National Institutes of Health, who is our largest funder of medical research, got an increase in funding, which is good. We actually had a win on accessible travel last year. Last year, American Airlines retold a policy they had about carrying weight on their planes, and essentially it barred folks from traveling with heavy mechanical wheelchairs, it's detrimental to the neuromuscular for some folks in the community. We quickly rallied, and to American Airlines' credit, they immediately corrected the situation once us and a few other groups told them that how that policy would affect the community. So that was a win there. We had a great virtual Hill Day, again, where we connected our advocates virtually to their members of Congress. And one of the things they advocated for that day was the end of surprise medical bills. So many, it was unfortunately, many folks might have gone to a doctor, they didn't know it was out of network, and they get hit with a huge bill, and that can be financially devastating. So we advocated for that on that Hill Day, but also we advocated for that a lot of times last year in COVID-19 legislation. And with that combined effort, a bill was passed last year that will go a long way in ending that the practice of surprise medical bills. So that's a lot, and I'm glad it's a lot because it shows you that your voice really does make a difference, and we are just really looking forward to the success this year. So this is the newborn screening program. This is a map of the country where states are screening for SMA, Pompe, or both. And when I showed this map last year, it was a lot less colorful. So over 2020, we got a lot more states adding a couple of those conditions to their regimen, which is very exciting. So I wanted to show this for two reasons. One, we made a lot of progress last year. And two, this is one of those instances, we got a question about this, about state work. Sometimes we have to work in states to get things done. It can't be done nationally. And we're working with a few volunteers across the country right now to try to get their states to add one of these conditions to their program. So lots of progress still to go, but this is one of those instances where we do work state by state. So if you're not a member yet, please join our advocacy network. There's two ways to do it. You can go to mda.org/advocacy and sign up there. But you also can text us. You can text MDA USA to 50457. So whatever is easier for you, you can go either way. Again, mda.org/advocacy or text MDA USA to 50457 to join us. We'd be really happy to have you. And then finally, hopefully you're jazzed and ready to go. We really could use help on one of our first campaigns of the year, which is the newborn screening program. So unfortunately, the newborn screening program at the federal level is not authorized. Its authorization lapsed. And we were very close last Congress to getting it reauthorized. It just didn't happen. But we're going to try it again. And this doesn't mean the program's not working. It's working fine, but it really needs to be reauthorized. There's some things we want to see to improve to it. So it's about time the program gets reauthorized again. And we just learned that the bill to do that was just released in the House yesterday. So there is some movement on this. So if you want to take action for us, please go to mda.org advocacy. You can click on the Action Center button, which I have an arrow to, and it's the first action you see on the right. So that's our first big campaign of the year. We really are hopeful we'll get it done this year, and when we do, it's because of your voices helping us do that. So with that, we have lots of good time for questions. I saw a few come in on the right hand of my screen. If you have questions, please put them in the chat box. And with that, that's my contact information if you want to email me. I love hearing from all of you. Don't hesitate. And with that, we'll take some questions.
Thank you, Mark. I am going to take the first one that I see here, which I think is a great question. And we have someone who asks, who do you see as our champions in Congress? So we have a lot of folks in Congress that have championed, one or many issues for us throughout the years. Many of their names come to mind from, Roger Wicker in Mississippi to Senator Casey in Pennsylvania. Tons of House members across the country who supported newborn screening. I will say that every House that last year, the House unanimously passed the newborn screening reauthorization on a voice vote. So, there are definitely members who maybe have an outsized influence on policy around neuromuscular work or have, a special interest. But I would say that any member can be a champion for MDA. And really what turns somebody into a champion is not necessarily outreach from me or Mark or Paul, but outreach from all of you to your members of the House and Senate to share with them why they should be supporting the legislation that we are pushing. And that's how we identify our champions. It really is through, grassroots advocacy engagement from the folks who really matter, which are the people who vote in every state and district. And when they hear from y'all, that's really how we identify our champions in Congress. And so, with what Mark just shared with you about, this opportunity to get engaged on the newborn screening reauthorization, I do ask that you each, send, click through, send that message, get your name into your members or your senators, email system, make sure they know that you're on the radar, and then keep calling them about things that are important to you. And, talk to us about interactions that you've been having with your members of Congress. I mean, we're easy to find. I know Mark's put his email up here, but you can also email us directly at advocacy@mdausa.org. And, help us identify new champions, because there's so many of them who could potentially, be the difference between ensuring that, bills are not led by one party or another, but, can be bipartisan and bicameral. And it's really those relationships established by our advocates that can get that done. So thank you for that question. I think that's really great and important. Another question that we have, and I'm going to throw this one to Paul, comes from Kelly, and she asks, how can we advocate to have children with muscular dystrophy get prioritized for vaccines so they can go back to school, please? Kelly, I get it. So let me ask Paul to answer the question. I know that this is a burning question for all the parents out there on this call. We certainly all want it to happen.
Yeah, certainly. And thank you for the question, Kelly. And yeah, as Brittany said, it's a question on the forefront of many parents' minds across the country, I'm sure. So the challenge with getting the vaccine to children, especially children who are under the age of 16, is that the vaccines have not been authorized by the FDA for children under the age of 16 as of yet. As you know, we have two vaccines that are available right now. The Pfizer vaccine was authorized for individuals 16 and older, and the Moderna vaccine was authorized for individuals 18 and older. And the reason why the vaccines were not authorized for children who were younger than 16 was because simply they were not in the clinical trials. The clinical trials only included individuals who were above the ages of 16 in Pfizer cases, or at the very least, there were only enough children in the clinical trials 16 or older to draw a statistically significant conclusion that the vaccine was indeed safe and effective for those individuals. So right now, it's not up to states, it's not up to the CDC, it's not up to the county or any of the local areas for if children are able to obtain the vaccine, because it's just unavailable to them as of now because the FDA has not authorized the vaccine for children as of yet. Now, there is some good news on the horizon. Pfizer is, and I believe Moderna as well, they're both conducting clinical trials right now for the vaccine in children. And hopefully this means that there will be data very shortly from those clinical trials that will show that these vaccines are indeed safe and effective in children, and therefore the authorizations can be expanded beyond just the adults or 16 years or older who are currently authorized to obtain the vaccine. And it can go for children as well, and children can be vaccinated sooner rather than later. Now, of course, another way that schools can perhaps reopen, and this may still not be the answer, perhaps, but teachers are being vaccinated. And depending on each jurisdiction's phase, some teachers are being vaccinated right now. And that, of course, can perhaps lead to schools being open sooner rather than later. But in any case, it's something we're keeping a very close eye on, the clinical trials that are ongoing in children, and we're very hopeful that authorization can be opened up to children very soon.
Thanks, Paul. I see a couple of other comments here regarding vaccination appointments. And so one thing, and I know that Paul touched on this when he was talking about vaccination for adults. One thing that we really want to hear from the community on is if you have tried to get a vaccine, have been told by your provider maybe that you're eligible to get a vaccine, but that you haven't actually, maybe then you've gone to schedule an appointment and have been declined, or showed up, at a pharmacy and have been turned away. If that happens to you or, family members or friends with a neuromuscular condition, please let us know. We really, are trying to keep track of this because it helps us determine if the states that have opened up vaccine access to folks with high-risk health conditions are actually considering certain neuromuscular conditions to be a part of that slate. So please do keep us in mind as you kind of navigate this vaccination process for yourselves and your family members, because we want to be aware. And if, for example, there is a state that has told or that has verified that they will be vaccinating folks with neuromuscular conditions, and we hear from someone and that's it, they couldn't get it done, then we need to be in contact with the state to tell them, listen, there's a problem, a lack of communication somewhere, to make sure that everyone who in our community who wants a vaccine can get one. But thank you for both of these questions here about access to the vaccine. I know we have about 15 minutes left, and I can talk forever, but this is the opportunity for you guys to ask us questions or submit comments or anything like that. So we'll leave the Q&A open for a few more minutes if anybody wants to submit anything.
Brittany, I'll add one additional point to the question or to the answer you just gave, and it was some good points from Mary Jo, and she was talking about working with her physician to obtain the vaccine, and she's hopeful that she'll be able to obtain it soon. We can't recommend strongly enough working with your physician on obtaining the vaccine. Now, it may be that they're aware that the vaccine could be accessible somewhere and they could assist with that. Of course, you always want to check with your medical professional on whether the vaccine is right for you. But if the state has opened up access to the individuals with high-risk conditions, then again, medical professionals that you count on can perhaps facilitate such access. Let's say your jurisdiction hasn't opened up access yet. It's still a good idea to talk to your physician, to talk to whomever you rely on for your medical care, because you can be prepared. You can be prepared for when your state or jurisdiction does open up access to individuals with high-risk conditions. You'll have anything you need ready to go. You will have already had the discussion, and you can get the vaccine from there, hopefully. So none of the three of us here on the call are medical professionals. We, of course, are not giving any medical advice, but your medical professionals can, and that's who we're recommending that you talk to. Access or no access immediately, always a good idea to talk to them about the COVID-19 vaccine in you.
Yeah, thanks, Paul. That's a great point. I'm not seeing any other questions coming into the queue at this time. So I will say, follow us on Twitter. We are at MDA Advocacy. You can find us pretty easily on email too. Like I said, advocacy@mdausa.org. We are always happy to chat with our advocates and champions. If you want to get more engaged, if you're sending emails that we send out and following us on Twitter and you want to get more engaged, please do contact us. We would love to chat with you about ways that we can work together. And we appreciate all of you joining us today for our first Advocacy Institute of the year, and look forward to being in touch with you and to having another one of these next month. So please join us. Thank you.